there. In this video, I'm gonna go over two of my favorite pain patches, the 701 plaster and the Wuyang patch that I use on myself and on patients. On myself, I use it for thumb pain when I work a lot, also for neck pain when I slept wrong. For patients, I use it for any kind of sports and orthopedic injuries. So think neck pain, low back pain, shoulder pain, post-surgical rehab, bursitis, tendonitis. The reason I like them because number one, they stay on for hours even after multiple hand washing. And number two, because besides the commonly used methyl salicylate, menthol, and camphor, they contain various plant extracts, so you actually get the therapeutic effects of plants as well. So first, I'm gonna go over the similarities between those two products, and then next, their differences and when to use which. So first, the similarities. They both contain menthol, camphor, and methyl salicylate, which is wintergreen oil. And these three ingredients often used together to relieve mild to moderate pain, irritation, and itching. The strong minty menthol smell and the cooling provide a different narrative, a different sensation to the brain, so the body can focus on a different narrative besides the pain. And they both contain various plant extracts that have pain, swelling, and inflammation and tissue regenerating properties. So what are the differences and when to use which? They both come in a can and they both come up in a rolled up format, that's what it looks like. The 701 plaster is 400 centimeter, which is 157 inches, and the Wuyang patch is 78 inches, so it's 200 centimeters. So the 701 is the double size. So basically you can cut it to whatever size you need it. The Wuyang patch also comes in a precut format. Besides their size, they have different ingredients. They contain different plant extracts. The Wuyang patch can be used in all stages of injury, so you can use it during the acute, the subacute, and the chronic phase. It can also be used instead of ice because it contains herbs that help with pain, swelling, and inflammation. The 701 plaster contains more warming herbs, so I wouldn't recommend it using during the acute phase of the first stage of the injury, but more in the subacute and chronic. The herbs used for this plaster are more warming, so they may aggravate the injury in the acute phase. So how to choose which one to use when you wake up with a neck pain or when you just throw your back out? I would use the Wuyang patch. However, for an older chronic neck pain or chronic low back pain, I would go with the 701 plaster. When you fell off the bike and you have a massive bruise, I would go with the Wuyang patch. Achilles tendonitis, I would go with the Wuyang patch. For Achilles tendinosis, an old Achilles injury, I would go with the 701 plaster. Shoulder pain, an older injury, the 701 plaster. For arthritis, chronic arthritis, I would go with the 701 plaster. Old bunion pain, 701 plaster. For an acute gout, Wuyang patch. Older injury and newer injury, and newer injury and older injury. For best outcome, use the pain patch as a modality besides the therapeutic exercise, the acupuncture, the physical therapy, or other therapeutic methods. Obviously, don't use it on open cuts and open wounds. And if you have a sensitive skin, you may want to use it on alternate days. So day on, a day off, or you may want to place it in a slightly different area because the skin may get irritated beneath the patch. And they are used for short-term pain relief, for long-term pain relief, or relief from chronic pain. Other modalities, techniques, and herbs may be better. Also, if the pain is not getting better, it's important that you seek proper care from a healthcare provider that you trust. Pain is often a signal of improper body use, which can cause joint and tissue damage. Simply masking the pain allows someone to continue the misuse without correcting it. So pain is just a sign that something is not right. And with quality care and ample attention, pain, even chronic pain, can be overcome or at least lessened.